Welcome to today's Friday Forum at the City Club of Cleveland. My name is Donald Cairns, and I have the privilege of serving as president of the City Club Forum Foundation. For 95 years, from the heart of downtown Cleveland, Ohio, the City Club has served as one of the nation's premier public podiums for civic dialogue about the most important topics of the day. It is my honor this afternoon to introduce our distinguished guest, Dr. Ezekiel Emmanuel. Dr. Emanuel is chair of the Department of Bioethics at the Clinical Center of the National Institutes of Health in Washington. He has devoted much of his talent and energy to end-of-life issues, including developing the Medical Directive, a form endorsed by Consumer Reports in the New York Times as a comprehensive living will. His book, The Ends of Human Life, received honorable mention from the Rosenhaupt Memorial Book Award by the Woodrow Wilson Foundation. He served on President Clinton's healthcare task force and thus has long and continuing experience with needed reforms in the financing of America's healthcare delivery systems. He may have greater knowledge than the average bear about the political process, as his younger brother, Ram, is the fourth-ranking Democratic member of the United States House of Representatives serving the 5th Congressional District of Illinois. Our guest has been a visiting professor at the University of Pittsburgh School of Medicine and at UCLA, and has held chair professorships at Johns Hopkins and Stanford Medical Schools. His latest book, Healthcare Guaranteed, A Simple, Secure Solution for America, was described by Mary Carmichael in the May 31 Newsweek as, quote, the most exciting book yet to come out of the country's medical crisis, quote. She urges all to read it twice and call your congressman in the morning. Dr. Emmanuel will speak to us today about his proposed guaranteed health care access plan for all. Please join me in giving a warm City Club welcome to Dr. Ezekiel Emmanuel.
It's a great pleasure to be here in Cleveland. I was just here 6 months ago, and to be in front of this venerable institution that is sort of the heart and soul and backbone of American democratic processes, and it's a great honor to be here. The American political scientist, probably the dean of American political scientists looking at Congress, has argued that to get real change in America on any issue, 4 things have to align. First, the public needs to recognize that there's a problem, and we need to have widespread agreement about the problem. Second, there needs to be agreement about a solution by the major actors involved and what the contours of that solution are. Third, we need a group that is going to drive reform through thick and thin, because reform doesn't happen quickly, it takes time. And fourth, there needs to be some transforming event, some catalyst that opens the policy window and allows that reform to be instituted. And if you look at some of the major reforms in America, particularly the civil rights legislation, you can see all 4 of these problems, all 4 of these steps involved. I want to consider each one of them for a second. First, the question of the problems of the American healthcare system. One of the things I do in most of my research at the NIH is a lot of surveying and polling, and I'm not going to ask your informed consent, but I am going to ask your participation. I have one question which I'd like to ask you. Considering all aspects, how well do you think the American healthcare system functions? Who thinks it functions very well? Okay, so we have about 4 or 5 people. Moderately well? A few more. Fairly well? Looks like the majority there. Not well at all. So more on the not well than the very well. This is only the second audience I've ever done that question to, where we've had people who say that the American healthcare system functions very well. The other audience was the Massachusetts Medical Society. I want to focus our minds for a second on some of the problems of the healthcare system. Now, most of you know that access is a problem. And most of you know the statistic that 47 million Americans don't have health insurance. But probably what you don't know is that of that 47 million Americans, 75% of them are either full-time workers or in the households of full-time workers. People who are working for a living, taking down honest jobs, they're not on welfare, and yet have no health coverage. That is very un-American. If you work hard, play by the rules, you're supposed to get the benefits of American society, including health coverage. And yet, 3/4 of the uninsured are playing by the rules and working hard, and yet not getting the benefits. In addition, 9 million of those uninsured are kids, and we couldn't possibly expect them to provide their own health care coverage, and yet they don't have health insurance. Beyond the access problem is the cost problem. In 2006, the last year for which we have statistics, the United States spent $2.1 trillion on health care. Now, you're a very smart audience here, but people have a hard time quite understanding how big trillion is. That's a lot of zeros, 12. But I'll give you a better way, a more visceral way of trying to understand how big trillion is. 1,000,000 seconds ago was last week. 1 billion seconds ago was when Richard Nixon resigned the White House. Some of you remember that day. 1 trillion seconds ago? Any idea? That's 30,000 years before the Common Era, 15,000 years before anyone stepped foot on North America, and we're spending 2 of those each year on health care alone. Another way of putting that is we spend more on health care than the entire economy of China, than the entire economy of France and Spain combined. So I like to say money isn't the problem. It's how we use the money. We have more than enough money. But it's not simply how much we're spending. It's the long-term projections into the future. If I had a slide, I would show you what I like to call the tsunami graph. Because if you look at healthcare spending into the future, if we do nothing about it, it is going to consume literally the entire economy by 2080. Nothing else. We are just on an unsustainable course fiscally. So that's the second problem. There's the access problem. There's the enormous cost problem and the growth in cost. Then there's the quality problem. Now, if I asked most of you, how good is your own personal health care, and I've done this question a lot, almost everyone thinks they get really good, high-quality care. But if you actually dig down in the numbers, we can't be so smug about the quality of care we're getting. There's a lot of data that it's pretty haphazard. As a friend of mine said, the United States is #1 in one healthcare outcome performance measure. That's cost. And we're not #1 in the world on any other health outcome measure. Not on longevity, not on infant mortality, not on how long people live at 65, not on cancer outcomes, not on heart disease outcomes. We're just not #1. And there are lots of data that we're doing a lot of unnecessary procedures that don't add to longevity and just cost money. I'll give you one very simple statistic. The Agency for Healthcare Research and Quality, which is a federal agency, looked around at blood pressure control. Now, this is a very simple illness. Easy to diagnose with a blood pressure cuff, and easy to treat. We have 30, 40, 50 medicines to treat it. Only 30% of Americans actually have their blood pressure controlled within the normal recommended range. That's just not good quality medicine. And this is not a complicated, this is not like cancer chemotherapy. It's not like complicated heart disease. Finally, as you probably know better than I, living in Cleveland, healthcare is an enormous drag on the economy. One of the statistics I like to say is most of us in this room are very well off and we're very privileged. And we get our healthcare coverage through our employer. But for our employer to give us healthcare insurance for our family, on average, costs $12,000 a year. To put that in context, that's like not only hiring you, but hiring another worker at minimum wage also to get you health insurance. It's like hiring 2 people. That's how expensive it is. No wonder it's a huge liability for employers, and they really want to figure out how to get out of it. But just recognizing that there's a problem, and most Americans by polls say that there's a huge problem with health care, we are not going to solve the problem.